Samaritan.
Good Samaritan. And that just reminds me of what our medics and our corpsmen did during the wars, what our doctors did in their surgical units. And my dad was a corpsman, and I think we've talked about that when we've talked about other war stories. And I'm so thankful that the Lord included in his scriptures, the stories of caring for people, especially as we're nurses. So would you pray with me as we begin? Father in heaven, we're so thankful for your word that you've given us. It reveals to us as much about you as you want us to know. The deeper we go, the more we know, the more we realize there's more to learn. One day we will be with you for eternity and begin to have a clear understanding and clear picture of you. We thank you for your word, Lord, that reminds us to be the good Samaritan, the one who stops, the one who heals, the one who helps, the one who takes on responsibility that's not ours, but that you put in front of us. Help us to be those kind of nurses, those kind of friends, those kind of caregivers, those kind of neighbors, Lord. And we thank you for those in this book, Lord, who set themselves aside to help others. Thank you for their stories, their journal, the writer, and this doctor who took it upon himself, Lord, to make advances that could help people live well. We're all familiar with what it means to look in a mirror and how hard it is when we have some little blemish that bothers us. But when we think of the destruction of faces, Lord, that we've been learning about, it really hits home. Be with us tonight and guide our conversations. May they be pleasing to you. May we learn from this, Lord, and may it help us in the ways that we serve. In Jesus' name we pray, amen. At the BNF Summit, a small group of us met for lunch, and we chose the selections for 2025. Has everyone seen them on the Facebook page and in the lamplighter? Okay, if you're wondering what they are, they're there. So in February, we'll be doing one on life without lack, living in the fullness of Psalm 23. It's a Dallas Willard book. You know, he'll take us deeper into what that means, deeper into Psalm 23 than we've probably been before. Then in May, it'll be The Glory Cloak, a novel of Louisa May Alcott and Clara Barton. And Libby Mahaffey will be leading that. You know, I've never thought about those two women in life, but I was at a pinning and doing a blessing of the hands for a local university here. And the assistant dean was talking about nursing pins, and she talked about Clara Barton and Louisa May Alcott. And I thought, oh my, there is that connection that others have known about, and this was all new to me. And then in August, it'll be Joyful Sorrow, Breaking Through the Darkness of Mental Illness. And a year from now, it'll be The Women by Kristen Hanna, and Donna Mitchell will be leading that. So those were all suggestions. We had lots of good suggestions. I think we'd need to meet every other week to be able to do that. But as we all know, life is very busy, and we're just thankful if we can read a book a week or a book a month. So good suggestions, and I think you'll all enjoy those. Linda will now lead us in the discussion of The Facemaker by Lindsay Fitzharris.
I'm just curious, have any of you worked with plastic surgery or in reconstruction?
No.
I didn't think so. I think I hear more OB or emergency room than. I heard about this book, and then I looked it up, and I enjoy reading nonfiction. I would say probably most of my books in my library are nonfiction books. But I thought it was interesting that Lindsay made a point that she wasn't really writing a biography or even a history. What she states in the note to us as readers is that rather what follows is an intimate account of the daily struggles Gillis and his team faced at the Queen's Hospital, as well as the men who suffered the double trauma of injury on the battlefield and the painful process of recovery. I don't know about you, but usually when I think of World War I just think of all the death. I think my first encounter about the severe injury was when I read Jacqueline Winspear's books. And if I don't know if you've read any of her books, but there's one book where she focuses on a man who was having problems because of the disfiguration. My grandfather also was in the First World War, but I have no idea any of his stories. The only story I know is that my mother remembers coming to Atlanta to see him off as he went to the war. So as you read the book, what was your impression? Did you learn anything new, or did you find it hard to read?
I found it hard to read. As a nurse, the goriness of it still bothered me. But I was intrigued the way to learn how the surgery developed.
I didn't find it hard to read. I couldn't put it down because I just kept wanting to see all of the advancements and, you know, what they did. So I was just like, I have to just keep on reading it.
I thought it was interesting, some of the terminology that was developed there. They used the word flap for the first time in reconstruction. I thought that was pretty interesting. And then bone grafts and how that was, you know, I sort of think of that as a more modern thing as bone grafts, but they were using them even before the First World War.
Marilyn, were you saying something?
I just said I was amazed at, I guess, how much they knew back then and how the pioneers, that those men did not mind trying things, anything to help these guys.
Yeah, I enjoyed how she took us back even centuries before, and that he built on some of those. I can't remember them exactly, but several times she had those observations how really it was back during the Egyptian time or in the Greek time, and how it was built on. Someone's talking, but I don't know.
That's why it's so important for us to have clear understanding.
I also liked the way she intertwined what the doctors were doing as well as the patients' lives and what they were encountering. And of course, the beginning, she says, you know, there could have been more pictures, but she chose to limit the pictures that she showed. And she did not show any of the pictures of failures, only those who were successful. Anything else that struck you as either difficult or easy or funny?
I thought the whole feeding tube was interesting. I never thought about that piece of it. I mean, I know that there's special feeding techniques for babies that are cleft palate and are in the process of those repairs and all. But I was trying to visualize them several times a day, having a tube passed down into their stomach to feed them because they could not. And I thought it was interesting that they developed the being upright and not being on your back when you're injured with that. And that became a protocol because of seeing that happening. It seemed like there was a lot of support for the work this doctor was doing in World War I.
Well, there was, but there wasn't too. He had a fight to get the hospital for the specialized hospital, and even fought to get the guys tagged to go straight to his hospital. So that he still had that politics that was in it. I was interested in how they divided a system on identifying the ones who needed the special treatment and getting them back to England as soon as they could. But what about the teams that he developed?
Well, yeah, I don't know if you can hear me, but I thought that was great that he had people from all over the world coming there and interdisciplinary teams, whereas some of the other doctors that he learned from were very, I'm the only one to do this, but he wasn't. But I thought it was also kind of funny when the Queen became, supported it. She got the money together, and then she got the doctor from New Zealand to come. I really want you to come. Well, who's going to turn down the Queen? So anyway, I thought that was good.
At least at that time of the century, yes.
Yeah.
I would have liked to have seen the visual of that dentist that had the dental equipment on the back of his car.
The French,
You know,
yes.
riding around. It reminded me of maybe the Batmobile or, or the Back to the Future cars or something. But I would have loved to seen a picture of that.
And to look at, he had surgeons, he had physicians, dentists, radiologists, artists. He had mask makers, photographers, using a whole variety of backgrounds in order to get it right for whoever he was working with. And I was reading one review and how he would ask, okay, what type of face do you want? And he would try to work with them in. But to me, what also was the realization that the military equipment that was used in the First World War was so advanced compared to the last war they had fought. And some of the things, I just made a note, some of the things they listed were like flamethrowers, chemical warfare, tanks, the air combat, the trench club, and the bayonet. I don't think I realized the bayonet was a new weapon as of the 20th century. But we think about what we have now, how much more damage it can do.
We have to think about how much protective equipment we have now, because you look back at the pictures, those little dinky helmets they wore, and
yes,
they had no protection, especially facial protection.
No, they weren't ready for it because that they never experienced that type of weapons before. And I thought it was interesting too that we call them tanks because they were trying to keep the Germans from knowing what that equipment was for. So it was supposed to be a water tank. And then one of the first stories is how the whole crew got burned up inside one. But
oh, go ahead.
Go ahead.
Oh, well, I was going to say, I made a few notes here, and the first thing that I have written down was, it was interesting that prior to World War I, they were concerned about a soldier's teeth because they used their teeth to open up the packets with the gunpowders. But in World War I, they didn't need their teeth anymore. And so there were no dentists. There was no attention to dental care until, this doc brought the dentist in on his team because he realized the importance of good teeth. So I thought that was interesting. I didn't know that little tidbit, those little trivia things.
And that's where the term trench mouth came from. Was in World War I.
Well, and if you look at some of the documentaries when they're marching through the lines and getting in the foxholes, and they would smile at the camera, they didn't have a lot of good oral hygiene.
Right.
Many rotten teeth smiling at you.
What did you think about her research?
Commendable. I'd hate to have to do that.
She was pretty thorough to be able to get meet all the people she needed to get journals and letters and that sort of thing, to find out just what was really happening.
Well,
Especially
even
since a lot of the journals, a lot of his work was, oh no, I guess it was the sculptures and the masks that were destroyed in the bombing when they bombed
yeah, the fire.
the royal. Sorry, I told you, I just read this 10 minutes ago.
About the
Yeah.
16th of,
Problem.
about 16th of the book was her, footnotes giving,
Yes,
I was like, oh my gosh.
thank goodness. Otherwise, I wouldn't have finished it right before.
And her writing was easy to follow.
Yeah.
She did a good job of making it sound like, a novel when it's really really nonfiction.
Mhm.
Like Donna said, she couldn't put it down. She just kept going from one chapter to the other. And
Well, and thinking about the artists and the masks that were made, the sculptors, and nowadays we have computer generated everything.
mhm.
And of course, they had no idea, but that's wonderful how those people were used. That made all the difference in what they were going to look like.
Yeah, and he was willing to try different avenues, like the artist, bringing in the artist, the face mask, working with dentist, realizing that he needed someone else that would construct the mouth because that wasn't his specialty. And he seemed to have kept his family together through all of this. So, and if I remember correctly, he even still on into the Second World War was active. And when you started the book, did you expect it to be what it was? I mean, with the title, The Facemaker.
It was more detailed than I thought it would be. I thought it would be more story-like, not knowing. And so it was interesting to see that it was really more like research, strung together through it. And in a really short period of time, that war wasn't a terribly long war. There was just so
Well,
much
it wasn't for
advancement.
us.
Not
but
for us, right?
Right.
Yeah, because
But for
It was
England, it was
almost
long.
5 years for England.
And to think that they just would sew up a face and then it had to be all opened up again.
Yeah.
And if they sewed it up and they were healing, they would send them back to the trenches. That's just so hard to understand.
And the anesthesia wasn't that great either.
You think?
Whew.
Well, it's better than the Civil War. So.
Yes, that's true.
I
And
think
no
we ran out of
antibiotics.
liquor in the Civil War, didn't we?
They have a stick in their mouth when they
Yeah.
do their amputations.
Oh, I can't imagine.
And no antibiotics either.
Right.
They were just starting at that time.
With sulfa. Yeah.
Yeah. And you think of all the antibiotics today that they'd be on, they'd have so many drips.
Yeah. So in a way, it's amazing these guys survived that did survive.
Yeah.
And, the repair wasn't just one surgery either. Some of them underwent 30, 40, 50 different surgeries to get their face repaired. But
Probably
That's a lot of
today it would
effort.
be fewer surgeries for that because of the techniques and the materials that we have, the sutures that we have today that they didn't have then.
And the ability to keep them under anesthesia much longer.
mhm.
With respirators and all. Yeah.
And of course, we'd have to have detailed psychological help today that, they didn't have back then.
Right.
And a lot of these people in recovery, when they came back to their homes, they became recluses. They didn't go back and get jobs. They were too conscious of their appearances, and some things just couldn't be.
And society wasn't welcoming.
No.
Yeah.
Losing
So-
a leg and you get pity, but losing a face. One of my friends was married to a World War, a Korean War pilot, and he was shot down, and his face and his whole side of his face and his arm was terribly burnt, and he didn't have much success with grafts and all that, but he was able to lead a normal life and married my friend, and they had a family and all. But I remember the kids, because my daughter was the same age as their daughter and played together forever and still are friends. But his face was it was so hard to look at him at first, you got used to it, and you could just tell it was a burn injury, but he didn't lose his eye, he didn't lose his nose. They were able to reconstruct the side of it. And he lost an ear, but that was pretty manageable.
My uncle was also in the Korean War
Mhm.
and had damages to his face.
Mhm.
And I was like 12 before I met him. But the stories and what I was envisioning as a kid, I was almost afraid to meet him. But by the time I met him, he had gone through all the surgeries, and you couldn't even tell. But just that encounter, when we talk about the face, it just sort of makes us pull back. We don't usually take the initiative if someone looks different. And they could have a prosthesis on their leg or the arm. We don't look, but with the face, it's like she said, we respond differently when the damage is done to the face. And we think about kids that you've seen that's had cleft palates and cleft lips, and how they're sort of pushed off to the side. And I was thinking that a lot of what's being done, especially in developing countries with cleft lip, a team comes in, they're there for a week or two, and they do, I don't know how many kids, but a lot of that is coming as a result of, what they pioneered with in the First World War.
One of the things that I noticed, sorry to join late, I had a little difficulty figuring this out, but at any rate, was the importance of your nose. When you see some of the pictures in the back, how the nose changed, sometimes it looked very large, but at least it looked like a nose. So you don't think about that part of your face so much as being so important to who you are. And also the part about how the dental folks were incorporated into all of this. Today, we just take that as an assumption that somebody will be doing the underlying part, not just the face, but they were just covering the skin over the area without doing anything for the structure or the architecture, as they called it. And I'd never thought about that so much either, that they really did start the multidisciplinary approach to medicine with this story.
They do.
Yeah. Any other observations?
I thought it was interesting that in the Army, we would refer to it as being field expedient, but how they invented things that they needed, to take care of whatever the problem was. And they mentioned this, remember the fire engine device to irrigate the face wounds? You remember reading about that? Yeah, I tried to envision what it looked like, but anyhow, but they were always inventing stuff and finding ways to do it. And I have no idea how they managed to, like Debbie mentioned earlier, feed them. Can you imagine? I mean, sometimes the trachea was exposed. I can't imagine. I don't know how I would have done working with those patients. And then once the war is over, here comes the Spanish flu.
And that came during,
Or during, yeah, well.
yeah,
Yeah.
because we took it over.
But you know, when we have things done with our face, you know, we just have to have a tooth pulled and we're, you know, absolutely miserable. I had a posterior bleed and had to have one of those rocket things put in my nose that blows up inside. I mean, my nose on this side stretched over to my ear, I think. And it was in there for 3 days. I said, I would rather go through childbirth or surgery than have this thing in my nose. And I think it made me think about all the things that were being done, having gone through that. I was a wimp, I'll tell you. My sister had to come sit with me and calm me down. It was lousy. So I can't imagine all of that, but I'm sure there were some people who said, just let me die. I don't want to go through this.
Mhm.
Yeah.
And some did die in the treatments because of infection that was rampant. And tetanus being so rampant then.
Mhm. I liked also the design of the hospital, how they gave us the picture of how the hospital was. I don't know if I can find it right now. How they set up the hospital. And he just pretty much went in and said, this is what I need, and we need this to be able to do this. And they were finally given the funds to do it, and he designed what he wanted and needed. And eventually became a general hospital after the war, but just even the creativity of what you need in a hospital to be able to accomplish what you want to accomplish. There weren't any, of course, today I'm sure there's probably hospital architects that's all they focus on how to, well, we just experienced that here in Atlantic because they just opened a new children's hospital. And Eggleston's at Emory closed, and all, especially the cancer patients, are all at the new hospital. But they even have robots in there making deliveries, you know, taking the linens and different things, and all the those little details. And here he was planning his hospital, but also working on his patients and training others to do it. And he kept going.
Fictions to be the conscience of our culture, even though our culture may not listen to what we have to say.
And he didn't care so much about finances either. I remember, reading.
Yeah, if he wanted to do it, he did it, and he
He
said the
did
money
it.
will come.
Yeah, the money will come.
We pray that God would bless this series.
I think Debbie mentioned the tetanus vaccine.
Mhm.
I thought it was interesting in one place where they said they had to know that they had the tetanus vaccine on the field and something about their injuries and their names, but some of them were listed as GOK, I believe it was. God only knows.
Yeah.
So,
Well, that very first injury that she shares, his friend had to find a third set of stretcher bearers that would even take his friend to the field hospital because they said he's going to die. So why waste our time? And of course, they were carrying it by hand on their shoulders. And we don't know how many kilometers they had to travel to get him to the field hospital, but
And they were at risk for being shot themselves
oh
while
yes,
rescuing somebody else.
yeah, because that really was just a standoff. Germans on one side, Allies on the other, and they just took turns shooting at each other or just staring at each other.
Well, put your head up over the edge of the
The
trench
trench.
and you're
a target.
yeah, and they're just, and it was so hard. I mean, there's some movie that Brad and I watched not long ago that showed them in the trenches, just walking over the dead, just walking. I mean, that is just so hard for us to understand.
And I don't remember.
That was probably 1914.
But when those things start to happen and it becomes the norm, you don't even think about it anymore.
Well, you're surviving.
Yeah.
Yeah. And if you read any of the writings during that time or right after that time, and Dorothy Sayers and her writings,
Mhm.
brings that up with her fiction, her mystery character, Peter Wimsey.
Mhm.
Because if you read her book closely, there's times when he just blanks out.
Mm.
He's the post-traumatic. We, of course, at that time it's called shell shock.
Right.
And that was probably more common than what is recognized.
Mm.
Yeah.
Well, I know it changes people. My mother had my grandfather's letters that he wrote to his mother. They've now been lost. No one seems to know what has happened to them, but I wish I could read those. But he went to the war, a positive person, a classical pianist. He went to do his duty, and he returned a broken man, physically and emotionally. And he had to work very hard to survive in the world. And he didn't make relationships well. He told me only once in my life that he loved me. And I was pretty shocked because he wasn't a touchy-feely, huggy type of grandfather. And I went out to the kitchen and said to my mother, Grandpa said he loved me. And she burst into tears and said, he's never told me that.
Mm.
And apparently he was a very loving son and brother before he went to the war. So it wasn't just, I think, the losing the leg, it was all the experiences.
And see, that was only for what, like a year? Because we didn't enter into 1917 and the war ended in 1918. So, our guys sort of got off easy compared to the Germans and the British and the French.
Right.
Because they were stuck there for 4 years just shooting at each other. So
I was reading another book when I finally got this one from Libby. I had to contact our library to get the book put on Libby so I could get a copy of it that I wanted to read. But at any rate, the other book was called A Winter Garden by Kristen Hannah. And it was the fall of Leningrad in World War II. And the horrors of that, then this one put on top of that, I just thought, just reading about it was almost enough to cause post-traumatic stress. I cannot imagine what it would be like to really be there. And in this case, to be a medical person and be there and know there's very little you can do except just keep moving the bodies. It would have been horrible.
I
well,
had I had an uncle that joined the army in the First World War, and he went to France, and he died there at 21 with disease. And if they actually buried him there, and then about 2 years later, they, I don't know what you call it, exhumed him and brought him to Washington. And he's now buried in Arlington Cemetery in Washington. He was my grandfather's brother, and my grandfather was just broken all the years I knew him over losing that brother so young. But his was disease. He never got into the battle.
Well, a lot of the deaths in the First and even in the Second War was more by disease than actually gunshots. Yeah.
And that
And
happened in
I remember
Vietnam
reading the
also.
word. Well,
Okay.
I remember reading about trench mouth. I'd never heard of that. And they were talking about that was related to dental disease in the trenches and all the water that sometimes would get into the trenches, and even the living conditions were bad.
Oh.
Very bad.
Does someone else have something? I thought.
There was, this is switching gears here a little bit, but I thought it was interesting that Marie Curie had a vehicle that was medically equipped, and she taught people how to do x-rays, and she was right out there in the middle of all the action, doing what she could. She trained women to be technicians.
Yeah.
I thought that was interesting.
Yeah, I think one thing interesting with her book is that she brought all these different people that you would not thought had been involved in a war, but the dentist who had his own little vehicle with all the equipment he needed going in to help instead of waiting for them to bring him out. And then like Marie Curie having taken x-rays to them. And she would not have been so young at that time.
And then there were all the countries involved. There were Canadians and there were Australians and New Zealanders. There were people from all over the world that were part of the British Empire at that time that came and served. There's a program about two women in Toronto, and one of them was an ambulance driver in the First World War, and one of the hour-long segments is about they called them the Tin Men. They were men who had wore metal masks because of their facial injuries, and they lived in the woods together, and they were persecuted. They were considered monstrous, and children would throw rocks at them when they came in to get supplies, and there were a few good people who would bring things to them, but it was eye-opening to watch that program focusing on them.
Would you want to go ahead?
Another interesting thing in the book is when she would, like, there's a section on rhinoplasty, and that was actually it's one of the oldest recorded surgical procedures in history, going back to over 2,000 years ago. And there were several other types of surgery that were done thousands of years ago too.
Yeah.
But the rhinoplasty, I didn't know that. They said something about the effects of syphilis, and I had no idea. I haven't looked it up. I didn't know that there was a relationship between that syphilis could cause issues with the nose, but I guess it can. And so there was a belief that the illness was a punishment by God, and that they shouldn't have anything done to take care of their noses. But anyway, there's a lot of interesting things in this book.
I like the way she intertwines all of that. That past history and the different, with even, like I said, the different disciplines that he depended on. He realized I needed to know this, and so he brought in an artist and the mask maker, and everything. They were just very innovative people at that time. But it's almost, if we're going to help, we've got to do something. And what do we do? And of course, today we just turn to the computer for the computer to tell us what to do. So, but
when we were talking about the pedicle that they do, as a new grad in 1970, I was working at a Jewish hospital here in Louisville, and two world-renowned hand surgeons, Dr. Kleinert and Dr. Kuth. Tell me you've heard of them, surely. They're both deceased now. But anyway, so they were pioneers in their field, and we had a lot of what they called cornhusker injuries, where the farmers would be out and they'd get their gloves caught in the machinery and they'd lose a thumb. And so they did a lot of abdominal pedicle grafts, and they would make new thumbs. And, so the patient would go around with his thumb and his new thumb attached to his abdomen for a long, long time, and I mean, it was very interesting. And then, so we got to see them again later when they'd come back and had that detached, and they had a thumb because, I mean.
Was it functional?
Yes. Functional thumb.
I think there's a picture of one of them in the book, of one of those.
The facial,
facial grafts like that. Yeah, it's not very attractive, but But it recreated the nose and the cheek and all that.
Well, and it was new then. It was a-
And so in 1970, so I'm kind of thinking, well, yeah, this was a good thing to do, but if they did this back in 1914, couldn't you have found a more efficient way to do this in 1970? Have we come a long way or not? I don't know. 1914 and 1970.
It would be interesting.
Yeah, it was.
Yeah.
It was a marvel, truly. I don't know what they do now.
I have to admit, I had no experience with reconstructive surgery, so I don't know.
Well, that's all.
And mine would have been 50 years old anyway.
Well, my Sunday school teacher, she had some, a really bad cancer on her nose. And so the doctor kind of did that same thing from her forehead down.
Mhm.
I didn't actually see it because she didn't come, obviously, to the church. She was that must and took a flap. The way she describes it, he took a flap from her forehead, so evidently, and I don't know that much about plastic surgery. That's kind of what I had envisioned in my mind after reading this book, because I really had no idea before it.
Well, it does look like, he sort of laid a foundation, and some of the basic principles are still being used, but in a different way, in a more developed way. He's done another book called The Butchering Art, and it's about the surgery done during the Victorian times. But I don't know if it would really, it may be just, if it's as, she does a pretty good description here on the reconstructive. I don't know what her descriptions of surgery during the Victorian age would be like. Because that again would be before any anesthesia, before, or very little, if any, because it was only during the Civil War that we were starting to see some type of anesthesia, but not prevalent. And then if we think back to what we read last year on the smallpox, and this, the surgery they did even during that time. So we've come a long way.
Yes, we have.
But I would say that this is talking about saving people's lives and not extending people just for them to extend life. And
I may not remember the full part of the story. Some of you may remember, but when he was trying to get patients brought to a central area early on in his story, and he went to the people who could do that, and they says, "We don't even have time for you. We're not going to deal with that." So he goes across the road and he makes his own labels, and he brings them back and gives it to them. And they just took them. And next thing he knows, people are showing up with the labels attached to them. And he's got his population of people to start working with. And we don't often think that sometimes those little things like that can make such a difference in how things proceed.
so they got them across the channel faster because of those. And, even that first story talking about how when he was first put on the stretcher and he realized he was choking on his own blood, that they later realized turn them face down and not on their back.
Well, there's something about the brotherhood of soldiers. They took care of each other. And so if one person heard about there's a tag and you can get some help, let's get a tag for him and get him to the right help, because everyone wants to be taken care of, and they had some choices in that. And some of to think that the whole bottom half of your face could be all open, that's just so hard to believe. But of course you don't see yourself, so you think whatever you can do to help me fix this.
Well, it's like that first story. It was his friend who finally recognized him. And it was his friend's effort to get the stretcher bearers to get him to the field hospital to start getting some help.
A miracle that he survived. Well, I know from my grandfather who had his leg removed. He had 3 different surgeries before he ended up with a very short stump. And he had a below the knee, and then he had to have above the knee, and then more above that, because there just weren't the antibiotics. So he had surgery in the field, in a field hospital, not a hospital, whatever they called them, unit. And then when he got to England, and then again when he got to Boston. And so all of that, what that does to a person when they see their leg becoming less and less, and you're 21 years old, and that's just really tough. We still have his wooden leg. My brother has it in a corner at the house. It was the big, heaviest thing you've ever seen.
If you mention that today, they won't know what you're talking about.
That's right. I
Because
know.
they're
This was
all metal
one.
and plastic now.
And my grandmother used to knit the socks that there was a certain kind of wool that he could have to go inside that. And it was a harness. It was a big strappy harness that he had, but it didn't bother him. He did all sorts he climbed up long ladders, extension ladders, to put the screens on the windows on the 2nd floor every summer on his house.
I bet you there's a medical museum that would love to have that.
Have his leg, yeah.
I'm serious.
I don't know who gets it in the next generation, but as far as I know, nobody wants it.
There was a man in our community who was in World War II and lost a leg. He happened to be with my uncle on a mountain in France when my uncle died. But he came home and he had an apple orchard, and he would climb, he would have his leg on to kind of get up in the tree, but it would bother him after he would get up in the tree. And they said he would take that leg off and just let it fall down on the ground. And people would walk in his orchard, and there his leg would be laying, and then he would shimmy down out the tree and put his leg back on, climb another. He was quite that was quite a feat, I thought.
Humans are very creative
Mhm.
and adaptable. So. Well, if you liked her writing, you can try her other book, The Butchering Art, but I think after reading this one, you may want to wait a few months before you read her book.
Have a break and read something light and Christmassy.
Or I was wandering in Barnes and Nobles, and I found a new mystery book. I haven't read it yet, called Arsenic and Adobo.
Oh.
Adobo is a special food in the Philippines, so I don't know.
Oh.
It's a cookie mystery series.
Well, that'll be right up your alley there. Linda and I love mysteries.
The mystery, yes. The cooking, no.
If you haven't read Jackie Winspear, start at the beginning. Her first book is about when she was over in World War I, and she's a wonderful writer. And she's not going to do any more of her Maggie Hope series. But
Thompson, yeah.
Yeah, Maggie, yeah.
I'm waiting for it to come out in paperback, and then I'll have the whole set.
Oh, you own the whole set. Oh, I own just the first book. The rest I got from the library. Yeah.
I'm still trying to learn how to use the library.
I do enjoy that.
But I think I read too much. Okay, I have a prayer I want to pray for us. How many of you are familiar with Richard Foster?
I know the name.
No. He's written Celebration of Discipline, and he's done a book called Living Streams, which is looking at the different traditions, looking at the strengths and the weakness of each tradition. And he's done one on prayer. he was a close friend of Dallas Willard. Dallas Willard, in a way, was one of his mentors.
Mhm.
He's Quaker background, but I'm in a book club with his organization. In our last podcast, he closed out a prayer for readers.
Hmm.
And it's something I have been thinking about too, because I do a lot of reading, but making sure that what I'm reading is what the Lord wants me to read, or that what I'm getting from the book is what he wants me to get.
Mhm.
And his prayer is sort of is along that line. So I would like, I would say that all of us are readers, or we would be part of the book club. Maybe not as much as mine, but maybe just give us some thought as I read this prayer. That he says, this is a prayer especially for every person reading. So now may your heart be settled by the Spirit of God, so that the words have life from what you see on the page to what comes into your heart. That it creates life, that the word comes alive into you for good. And the word here is a capital word, W. If there's anything that is destructive, that it simply passes away. If it doesn't anchor itself. If there's thoughts that the words bring up that aren't helpful, that they just slip away. That you, in your reading, will be surrounded by the light of Jesus Christ. You will be covered by his blood, and you will be sealed with his cross. May that be so that for every person, and if there are phrases or words or sentences that we stumble on, be our teacher in that. And if it is, the time isn't right, that sentence or paragraph, it can just slip away. We don't have to learn and remember everything. So help us learn and know what we need, Lord, for today, for ourselves and our friends and our family and our children. May it be so, we ask in Jesus' name. Amen.
Very nice, Linda.
So,
All right. Well, I think Beryl's going to take a picture now.
Yes, if everybody could look up and smile. And let's see. Okay, I'm going to say 1, 2, 3. And I'll take one more just to be sure. All right, very nice. And I'll stop recording now because I think we don't need to record our chit chat probably. Weird. Yeah. Okay.
All right. Thank you all for being here tonight. And we look forward to gathering again in February.
let me say,
Spear, is that-
Jacqueline Winspear. Yeah.
Jacqueline Winspear.
Okay.
Yeah. And as you read Dallas Willard, he's sort of like